Hi everyone, I am Al-sahaf Hadjimanan from Arellano University College of Nursing Year 2, and for today's video I'll be doing the Leopold's maneuver, but before we start I'll explain what the procedure is. So the Leopold's maneuvers are a systematic method for palpating the gravid uterus. This technique involves abdominal palpation and it is both low cost and non-invasive. It is commonly used to determine the position, presentation, and engagement of the fetus within the uterus. And now let's proceed to the preparation. So before beginning, instruct the mother to empty her bladder, then position her in a dorsal recumbent position with her knees flexed to help relax the abdominal muscles. Consider placing a small pillow under her head for comfort and drape her appropriately to maintain privacy. Explain the procedure to the patient, including what she can expect during the examination. To ensure comfort, warm your hands by rubbing them together before beginning the palpation. Using the palm of your hand rather than your fingers, gently palpate the abdomen to avoid any discomfort or unnecessary stimulation of uterine contractions. And now let's proceed on how this procedure works. So the first maneuver is fundal grip. So the finding here is if it is cephalic, the head is more firm, hard, and round that makes independently of the body. If breech, it is less well-defined, moves only in conjunction with the body. So the purpose of this procedure is to determine the fetal part lying in the fundus and to determine the presentation. To do so, use both hands to feel for the fetal part located in the fundus. The second maneuver is umbilical grip. So the finding is when palpating the fetus, the back will feel like a smooth, hard, and resistant surface, when the knees and elbows of the fetus may be felt as a series of angular nodulation. The purpose of this procedure is to identify the location of the fetal back and to determine the position of the fetus. To do so, use one hand to steady the uterus on one side of the abdomen, while the other hand moves in a circular motion from the top to the lower segment of the uterus to feel for the fetal back and small fetal parts. Use gentle but deep pressure during palpation. Next is the third maneuver, which is the pollex grip. So the finding here, if the presenting part is not movable, it is likely engaged. However, if it is movable, it has not yet engaged. So the purpose of this procedure is to determine the engagement of the presenting part. To do so, use your thumb and fingers to grasp the lower portion of the abdomen above the symphysis pubis. Press in slightly and make gentle movements from side to side to assess the mobility of the presenting part. The last maneuver is the pelvic grip. So the purpose of this procedure is to determine the degree of flexion of the fetal head and to assess the fetal attitude or habitus. To do so, face the foot end of the woman and use both hands to palpate the fetal head, pressing down about 2 inches above the inguinal ligament. So that's it. Thank you guys for watching. Bye bye.